Anxiety and panic disorders. Anxiety and panic disorders are some of the most common psychological struggles people face, yet they are often misunderstood. Many individuals think anxiety simply means worrying too much or being nervous, but in reality it is much deeper and more powerful. Anxiety affects both the mind and the body, shaping the way a person thinks, behaves, and responds to everyday situations. Panic disorders take this experience even further, creating sudden and overwhelming waves of fear that can feel life-threatening even when there is no real danger. Understanding these conditions in simple, human language is important because millions of people experience them without fully knowing what is happening inside their bodies and minds. Anxiety begins as a natural reaction. Every person is born with the ability to feel fear because fear protects us. When someone faces a threat, the body immediately prepares to respond. This is known as the fight or flight response. The heart beats faster, breathing speeds up, muscles tighten, and the mind becomes sharply focused. This response is extremely helpful in situations that require quick action, such as avoiding an accident or dealing with a dangerous event. The problem occurs when this response activates too often or without any real danger. For some people, the brain becomes overly sensitive and signals danger even during everyday situations like talking to people, going to work, or being alone. When this happens frequently and intensely, it becomes an anxiety disorder. People with anxiety often describe feeling constantly tense, worried, or restless. Their minds may jump from one fear to another, imagining worst-case scenarios even when everything seems fine. They may worry about their health, relationships, finances, or future in a way that feels uncontrollable. Anxiety can also appear as physical symptoms. Some individuals feel their hearts race for no reason, experience dizziness, stomach pain, headaches, sweating, trembling, or a sudden feeling of heaviness in the chest. The body and mind become tired because they are always alert. Anxiety is not a sign of weakness or lack of faith. It is a condition that develops from a combination of genetics, environment, past experiences, and even childhood patterns. Panic disorders are more intense. A panic attack feels like a sudden storm that arrives without warning. A person may be sitting, working, shopping, or even resting, and suddenly feel a rush of terror. Their heart may pound so fast that they believe they are having a heart attack. Breathing becomes difficult, and some feel like they are choking or losing control. Others experience numbness, shaking, chest pain, or a sense of unreality where the world seems strange. Many fear they might faint, collapse, or go insane. Even though panic attacks usually last only a few minutes, they feel incredibly long and frightening. After experiencing one attack, individuals often fear having another, which creates a cycle that affects daily life. They may avoid crowded places, long distances, or any situation where they fear help might not be available. What makes anxiety and panic disorders even more challenging is how invisible they are. A person can appear calm from the outside while fighting intense inner battles. Many people hesitate to talk about what they feel because they fear judgment. Some are told to stay strong, have patience, or simply stop worrying, which does not address the deeper issue. Anxiety is not solved by simple advice because it is rooted in how the brain processes danger. People with these disorders often feel isolated, misunderstood, or frustrated because they cannot simply turn their feelings off. However, understanding that anxiety is a medical and psychological condition helps remove shame and opens the door to healing. Scientists and psychologists explain that anxiety disorders can develop from several factors. Childhood trauma, or growing up in an unpredictable or stressful environment, can train the brain to stay on alert. Genetics also play a role, meaning anxiety can run in families. Long-term stress, lack of emotional support, sudden life changes, or major losses can trigger or worsen symptoms. Even lifestyle factors such as poor sleep, unhealthy diet, and lack of physical activity can increase anxiety because they affect the brain's chemical balance. Sometimes anxiety appears without any clear reason, which makes individuals question themselves even more. But the truth is that anxiety is not the person's fault. It is a condition that needs understanding and proper care. People with anxiety and panic disorders often develop certain behavior patterns to cope. Some avoid social situations because they fear embarrassment. Others overthink every decision, seeking reassurance again and again. Many people become overly self-critical and expect too much from themselves. Physical symptoms such as stomach discomfort or headaches may lead them to believe they are seriously ill, which increases anxiety even further. These thoughts and behaviors become cycles that strengthen the disorder. Breaking these cycles requires patience, awareness, and supportive environments. Thankfully, anxiety and panic disorders are treatable. One of the most effective approaches is learning how to understand and manage the body's reactions. Deep breathing, grounding techniques, and slow physical movements help calm the nervous system. Psychologists often teach individuals to challenge fearful thoughts and replace them with realistic ones. This does not mean ignoring problems but learning to face them without letting fear control every decision. Some people benefit from therapy that explores past experiences and emotional memories that may be shaping their current reactions. Others may need medical support when symptoms are severe. Physical exercise, healthy sleep habits, balanced nutrition, and supportive relationships also play an important role in reducing anxiety symptoms. Another important part of healing is learning to be kind to oneself. People with anxiety often struggle with guilt, thinking they are overreacting or wasting others' time. But acknowledging their feelings without judgment helps reduce emotional pressure. Understanding triggers, expressing emotions, and building confidence gradually allow the brain to feel safe again. When the brain learns that certain situations are not dangerous, anxiety begins to weaken. It is a slow process, but many people recover and lead peaceful, fulfilling lives. Anxiety and panic disorders do not define a person's value or strength. They are conditions that require care, understanding, and support. If you or someone you know struggles with these issues, remember that seeking help is not a sign of weakness. It is a step toward healing and reclaiming control over life. With the right knowledge and tools, individuals can learn to calm their minds, manage their reactions, and rebuild confidence step by step. If you found this explanation helpful and want to support more content like this, please like this video and subscribe to the channel for more educational and inspiring discussions.